Fetal alcohol syndrome is the umbrella term for a range of disorders. These disorders can be mild or severe and can cause physical and mental birth defects. The type of fetal alcohol syndrome disorder includes fetal alcohol syndrome, partial fetal alcohol syndrome, alcohol-related birth defects, alcohol-related neurodevelopment disorder, neurobehavioural disorder associated with prenatal alcohol exposure. Fetal alcohol spectrum disorder is the term used to describe the lifelong physical or neurological development and impairment that can result from fetal alcohol exposure. Fetal alcohol syndrome disorder is a condition that is an outcome from parents either not being aware of the dangers of alcohol use when pregnant or planning a pregnancy, or not being supported to stay healthy and strong during pregnancy. If a woman drinks alcohol while she is pregnant, the alcohol crosses the placenta from her blood into the baby's bloodstream, and the baby is exposed to similar concentrations of alcohol as the mother. The majority of children and adults who live with FASD live with significant cognitive, behavioural, health and learning difficulties, including problems with memory, attention, cause and effect reasoning, impulsivity, receptive language and adaptive functioning disorders. These difficulties are lifelong and have significant impact on behaviour. Positive outcomes can be achieved when parents are appropriately supported to understand their child's behaviour as a symptom of brain damage. Not all babies exposed to alcohol develop FASD. The risk of harm to the fetus is highest when the mother drinks a large amount of alcohol very often. For example, if she is a heavy drinker or frequently binge drinks. However, due to the nature of this condition, there is not a large amount of information about how much alcohol is dangerous. Therefore, mothers are advised to be cautious about alcohol consumption at all. To understand how fetal alcohol spectrum disorders occur, we must first understand the role of the placenta. The placenta is an organ that develops in the uterus during pregnancy. This structure provides oxygen and nutrients to the growing babies and removes waste products from the baby's blood. The placenta attaches to the wall of the uterus and the baby's umbilical cord arises from it. When a pregnant woman drinks alcohol, some of the alcohol easily passes across the placenta to the fetus. The body of a developing fetus doesn't process alcohol the same way an adult does. The alcohol is more concentrated in the fetus and can prevent enough nutrition and oxygen from getting to the fetus's vital organs, inhibiting their growth. The risk increases if the mother is a heavy drinker, as damage can be done in the first few weeks of pregnancy, when a woman might not even know that she's pregnant yet. Popova and colleagues in 2017 found that alcohol use appears to be most harmful during the first 3 months of pregnancy. However, consumption of alcohol at any time during pregnancy can be harmful to the fetus. Since fetal alcohol syndrome covers a wide range of problems, there are many possible symptoms. The severity of these symptoms ranges from mild to severe, and Jacobson in 2002 suggested that it can include all the symptoms shown on the screen. To diagnose someone with FASD, a doctor must determine that they have abnormal facial features, slower than normal growth, and central nervous system problems. These nervous system problems could be physical or behavioural. They might present as hyperactivity, lack of coordination or focus, or learning disabilities. We're just going to take a moment now and watch a few case studies of FASD.
Well, science was difficult for me at first until I got to chemistry. Science because it was hard because there was no hands-on, it was all focused, look at the words, figure out. And also, reading I got a lot better throughout the years. I had trouble reading words and I read it where I couldn't follow the word next to it. Well, when I first was young, I had a lot of anger issues. I was not able to do anything. I was run around like a maniac, be angry, not focus at all. I have also trouble organizing stuff, organizing and my belongings and stuff, so that has struggled with me. One thing I really struggle on is like concentrating on one thing.
Last week, I got in a fight with someone. He hit me first, so I hit him back.
The fact that I got as far as I have without like having a breakdown at any point, a really big one, I got really lucky.
Why are you upset?
When my birth mother drank when I was in her womb, that it affected parts of my brain and all that.
She said that my mom drank alcohol and it damaged my brain.
Restrained somewhere along the line as he got older because he'd just tear up everything. We were afraid that he was going to hurt somebody as he got older, but you can't let him see the fear because that just makes him stronger and more determined that he's going to do something.
Do you get into trouble a lot?
Sometimes. They arrest me, take me to jail, 3 days.
I worry about Allison as she gets older on her own. Who's gonna be there to tell her right from wrong?
Everything was stacked against this child before she was even born. And the fact that she could scream at 3 o'clock in the morning was a good thing.
I'm sure that something like this can drive a wedge in between a couple, but we have chosen to use this to strengthen us, and it has.
It's important to recognise that the effects of FASD cause a variety of complex challenges for children. As a result, no two children with FASD will learn and function in the exact same way as their peers. Therefore, it's our knowledge and experience and guidance and encouragement that these pupils need the most. I think these videos really highlight for us that there's a whole range of different abilities and struggles that people with FASD come across during their life, and hopefully they showed you how valuable it is to spend time with the students with disabilities such as these. Intellectual abilities of students with FASD can vary greatly. Some students with FASD have difficulty with sequencing, memory, understanding cause and effects relationships, and may also suffer from learning disorders such as ADHD. Other students may only need minimal extra assistance to most. Students with FASD may also display a variety of atypical responses to familiar or frustrating situations. Increased anxiety may result in withdrawal, outbursts or other acting out behaviours that may be harmful to the students or the group of children that you're teaching. A young child with FASD may have severe temper tantrums and find it hard to adjust to change. Many adolescents with the same disorder are prone to depression, poor judgment and impulsivity. They're often described as innocent, immature and easily victimised. Some children with FASD excel in individual sports that require gross motor coordination, such as swimming, skiing and soccer. Others have significant delays in gross and fine motor skill development, which can affect all areas of functioning. In mild cases, these delays in motor abilities can influence the acquisition of skills, such as tying shoelaces and handwriting. In more severe cases, children with the same disorder actually have problems chewing and swallowing their food, which can be detrimental to their overall health. Teachers should be alert to the fact that the number of these health concerns can directly impact a student's ability to achieve success in the classroom. In some cases, a student's medical report will include recommendations to the school that assist in program planning. Each child presents a complex and individual portrait of competencies and delays. Some students with FASD must be recognised as individual rather than members of a homogenous group of children, as seen in most classrooms. I've got another quick video to show that takes a quick look into how students with FASD may perceive certain situations. And I think it's helpful to consider this so we can better understand how to relate to these students. So have a look.
The impact of prenatal alcohol exposure on the brain is highly variable. There are some areas of brain function that are more vulnerable to the impact of the alcohol. Consider the upward and outward progression of the neurons and glial cells that was just described. Which neurons may be more vulnerable to the exposure of alcohol? Those traveling a short distance or those traveling a long distance? The correct answer is those with further to travel, as there is a greater likelihood of misdirection and greater dependence on lower-level systems to function effectively. The regions farther from the center are often referred to as higher cortical functions and include functions such as problem solving. Our basic functions, heartbeat and breathing, are in the lowest region. In the middle are many of our species' survival components, including our fight and flight responses, as well as our sexual drive. Thus, in FASD, we find the basic systems intact, and the middle systems, also known as the limbic systems, generally functional, but the higher systems required to manage those limbic systems, for example, management of a desire to fight to defend, are most affected. So, an individual with FASD may be very good at protecting themselves from a perceived threat, either by fighting or running away, but may not be as good at determining whether something really is a threat, or deciding how best to respond to that threat given a specific context. Responding to an unintentional bump in a shopping mall or school hallway with a punch may reflect this misinterpretation of threat and a poor threat response, and this behavior is a reflection of injury to the brain, not an indication of mean or oppositional behavior. Thinking of the brain this way requires us to change our perceptions so that we can support alternatives rather than punish an individual for behavior that resulted from brain injury from prenatal alcohol exposure.
Consider the following process in preparing for and working with your students. Your principal or special education administrator can assist you to access specialised personnel in the school. And first of all, ask the question, what is the student's learning strengths and needs? From there, collect information, reports, summaries, doctor's notes, past educational plans, talk to parents, talk to students, observe the student in the classroom and make judgments about how you can best be helping them in this situation. From there, it's important, step 2, to make a plan and carry it out. Ask the question to yourself, what does the student need to achieve success in my classroom? This might mean making a new selection of resources, consulting professional peers, trying new things, and adapting old activities to suit their needs. And then after that, step 3, evaluate the plan that you've created. Ask the question, is the student comfortable working with the supports provided? How do the parents feel about the plan? And is this plan being effective on its own, or do some other resources need to be implemented into it? Also, can these supports be paired or alternated with others to lengthen the period of effectiveness? So in the longevity of their schooling education, how will these plans play out? If the plan's been evaluated and it's not wholly successful, how can the plan be adjusted to be more successful? What other ideas do you have that you'd like to try? And should learning assistants or resource teacher be placed into the classroom to support you for the benefit of this school, for this student? And should the student be referred to a school-based team, such as counsellors or independent learning support? And then should they be referred on for additional assessment after that? The final step in this plan is to make a referral. Following classroom intervention, we should decide whether or not to make a formal request for additional support, so learning advisors in this classroom. If the student continues to struggle in the classroom after these adjustments have been made, the teacher, in consultation with the parents, may decide to refer the student to other in-school personnel, such as learning assistants, resource teachers, school counsellors, school-based teams, anything that the school actually provides can be referred on to. A number of national and international education developments support the need for increased personalised learning. This paradigm shift has been unfolding for some years and is becoming embedded in mainstream teacher training. Personalising learning for children and young people living with FASD is at the core of improving the life chances of this vulnerable group of students. Noted education researcher and writer Hargraves, 2006, points to the vital role teachers play when he observes that personalised learning requires teachers and schools to respond to the needs of individual students in a very targeted manner. Children and young people living with FASD will need specialised support to personalise their learning. The Australian Curriculum Assessment and Reporting Authority national curriculum includes advice about meeting the needs of students with disabilities. This advice includes the requirement that all students with a disability are able to participate in the Australian curriculum on the same basis as their peers through rigorous, meaningful and Principals and schools should give consideration to reasonable adjustments to ensure that students with disability are provided with opportunities to participate in education and training on the same basis as students without disability. Before any adjustments are made, consultations take place between schools, students and parents or carers. By providing opportunities, providing opportunities where students with FASD can actually thrive is vital to their ongoing education and their success. So some practical tips for implementing that in the classroom would include providing opportunities for the students to work in small groups. This will provide a secure environment in which the children and young people may feel more confident to ask and respond to questions that they wouldn't normally in large group situations. Also providing tactile examples of what you're teaching, allowing the student with FASD to touch, see and feel something that will help him or her to succeed in the learning that you're actually offering is really vital to their overall success. Then you can use the students' own life experiences and knowledge when teaching new ideas to the class that's relatable for them. If children have difficulty learning to read, encourage them to build up sight vocabulary by using multisensory approaches such as look, cover, write, check, but be expected that you'll be repeating words frequently. And this is just part of the learning process for them. Provide listening posts or DVDs of a variety of text, literature and social stories. Making it more personal for them is bound to be a way that they engage more with the learning environment. And then when you're actually demonstrating concepts, show rather than tell, and be prepared again to repeat the demonstration and instruction several times for them. Consider whether non-compliance with rules is due to a lack of understanding or because the children have been distracted. That video before showed us how their brains are working, so maybe just take a little bit more time to consider what their brain would have been thinking when they did that certain thing. Also just really important to check the child's understanding frequently of instructions, particularly in relation to homework, because you're not going to be there to support them in the home environment, and so they'll need that extra assistance. Also remove as many distractions from the learning environment as possible, and provide them with a quiet space to discuss sensitive issues, and also just a place where they can go to calm down. It's really important that they have that separation when it gets all a bit too much for them. So there's some practical tips for you to be applying in the classroom. It's important that we have a great understanding of the overall of FASD, because it's such a big issue within society at the moment, and educating students with FASD is going to help prevent the cycle from occurring again. And so just really important that we're considering these things in our own classrooms and that we're applying them to